Hi, good afternoon. I'm Raymond Kwong. Thank you for joining this session on how AI assists CMR, cardiac MRI, using Vista.ai is possible. I want to share my experience and our program at the Brigham Women's Hospital, or better known as MGB, Massachusetts General Brigham, in Boston. And we have been applying this technology for approximately 7 to 8 months, concentrating mostly on the first 6 months. And I want to show some of the results. These are real-world clinical adaptation of a AI assist program. So we're very excited about this addition to our program. Here is my disclosure. I do not receive any financial support from Vista AI. And this collaboration has been a joint focus for the scientific pursuit and clinical adaptation of this technology. Here's my disclosure. So let me just tell you a bit more about our MRI program over the last 20 years. And I'm just showing you the growth in the last 10 years. This is a Boston-based program in a teaching hospital at Harvard Med School. It serves the neighborhood of about a 2.5 million population-based catchment area, and we have seen a substantial amount of growth. And I'm only showing you 10 years because the program has been about 20 years old. The majority of the growth is really in the last 3 years. As you can see, the rapid increase of the demand for cardiac MRI studies. And we're projected to be over 2,000 scans to be done at the Brigham this year. So, but those numbers are really just, I would say, is a tip of the iceberg, because we are serving a much larger area across many, not only the Boston area, but also the vicinity of Boston, covering, as I mentioned, a span of about 2.5 million catchment area of patients. And we need to cover multiple sites. Patients that are sent in, inpatients or outpatients, sent in from different sites. And we operate based on, at the Brigham Women's in Boston, we have 4 scanners that are capable of doing cardiac, one of them being the workhorse, a 3T scanner, but we also have accessibility to 3 other scanners in the campus. But not only that, we have to serve our neighboring hospital, the Faulkner Hospital, which sends potentially unstable patients over an ambulance to our Longwood Brigham area to scan. And that can create some sort of challenges, right? As you can imagine. We also have a large patient population down south in the Foxborough area, where there's a large population of patients that need this technology for urgent cardiac planning. So with that, you can see that there's a lot of challenges that may not have a very simple solution. So we've thought about this over the years and said, how can we meet the needs of the program? Well, the needs are, at the present time, before we apply Vista.ai, we have been operating at pretty much full capacity. We have technologist coverage for 12 hours a day, 7 to 7, 6 days a week full-time, inpatients or outpatients. We have 1 day that are emergency inpatients only day, which is Saturday. And with that, we churn out about 12 to 14 studies, actually, give and take a day. And even with that amount of effort, we still are looking at a 3 to 4 week of outpatient backlog and a 2 to 5 day inpatient backlog. And these are considered unacceptable from our operational standpoint, from our institution. So under tremendous pressure to handle this, to improve this backlog. We also have, as I mentioned, challenges from the fact that we have to take care of patients that are shipped from other neighboring hospitals that are potentially unstable. We prefer not to ship them. And there are scanners there. So how can we manage that? We have to handle 4 different scanners from 2 different vendors, and they all have different software platforms. And also we want to preserve the many years of collaboration in research. So we have to accommodate not only clinical sequences, but also research pulse sequences as well. With that, other challenges also include, we have a team of dedicated physicians and technologists, but they are at different level of experience. So how do you harmonize all these needs into a better run program that can serve our patients better? Certainly, buying more hardware, zoning more MRI machines could be an option, but that will not solve all the issues, right? And also, of course, the cost can be prohibitive as well. We want to deliver the most detailed exam for the majority of patients with cardiomyopathy. Cardiomyopathy patients constitute about 80% of all the referral sources in our program. We have to serve many of them are fairly unstable and sick, and all of these patients may have undiagnosed cardiomyopathy that require a battery of these sequences in order to answer all the multiple questions that are raised clinically. So without going into the details, we may not need to do all of these pulse sequences to answer all of these questions about cardiac function, anatomy or physiology, but we need to answer many of them in most of the cases. So most of the cases, we have to play out at least 5 or 6 of these in a given CMR session. So how do we handle that? Without AI support, our technologists, even the ones that are most highly trained and experienced, will still require about 55 to 60 minutes to carry out a successful study. But obviously, being inside a scanner for 55 minutes for a patient is a lot of stress and is not always feasible. So we have to understand that we have to look for better solutions. MRI is complex, and cardiac MRI is quite a lot more complex because of the need for gating, unstable patient, larger patients, claustrophobia. And as I mentioned, and you see here that a majority of the scan, when the patient's inside the scanner, majority of the time, we're actually spending time on preparing the slices, preparing the angles, preparing for the optimal parameters in order to deliver a diagnostic scan. More than 200 clicks for a cardiac MRI exam, that's very tiring, even for the most experienced. So a lot of these parameters can be modeled by AI, by itself, but also can be learned over time with the preference of our own program. So we started investigating that option several years ago in collaboration with Vista.ai, and we are quite excited to see some of the results. Now, so what does Vista.ai AI assist? This is, again, I want to emphasize, is AI assist. It does not take over the control by the physician or the technologist, but it offers an assistance, and it comes in 2 forms. Either you can use the 30 or 40 AI FDA-approved sequences that are for cardiac MRI from HeartVista, or you can also choose to use the AI technology to control the scanner to run the Siemens provided or vendor provided pulse sequences. And I mean that this is applicable to Siemens and GE as well at present. And the list may actually expand to others. So our personal choice at the Brigham was to do a combination of both. We want to get the best of both options. But we primarily focus on running as many of the sequences that are available to us, be it our own development or collaboration with others, or the ones that are provided by our vendors. So we want to have that nailed down as a solid option. So there are many pulse sequences that are used in cardiac MRI for, as I mentioned, there's a multitude of needs to answer cardiac structure, function, and physiology in the heart in order for us to make a decision. So the AI Assist by Vista.ai basically does it by 4 components. The first one is it takes away the need to plan, to manually look for the anatomic landmarks, to plan for the coverage, plan for the field of view. It takes all that planning away and performing it by AI Assist. And that's a huge help, in my opinion. You can see what you're seeing is actually the real-time localization. It literally takes a couple of minutes. And I will skip over that. So the planning also involves optimizing the image sequences, getting the no time done, getting the physiological component actually nailed down correctly without the need to have manual preparation. So that also is a big help. I'm just going to show you the last component is that the AI will actually perform the post-processing quantitation of a vast number of parameters that are useful clinically, such as perfusion, myocardial strain, quantitative mapping. So all these are extremely helpful. So after launching MRI in Vista, we noticed 31% shorter and substantially more consistent scan time, better imaging quality, and all the attendings are in need, are demanding the use of Heart Vista. You can see that when we apply on this graph, on the right is when AI is applied entirely. On the left is AI was not applied at all. In the middle bar is when a combination of AI and traditional conventional scanning was involved, a hybrid of the two solutions. We noticed that the substantial improvement of scan time, 31%. But note that error, note that bar, the variation, the consistency of scan time is 3 times better by AI assist. Our technologists over time, over a short period of just 6 months, have progressively adopted this AI. There are technologists who learn it over 2 weeks or even just 1 week and entirely transition to using the AI technology and with great results. So there's a bit of a learning curve, but it's actually very surmountable in my opinion. And the quality, as I also mentioned a little bit before, the key images, Cine images and LGE quantitation provide substantially higher image quality as we quantify these images of about 1,000 patients who had cardiomyopathy. Here's a case. This is a patient who was sent and underwent a study of about 56 minutes. The patient has some gating issue, has some issue lying flat, but so there is some quality issue. The no time was not selected properly, cannot see the area of infarction or infiltration adequately well. There is motion blurring. There's the fat images were also quite blurred. The patient has to be brought back on a different day and had a repeat scan using AI, using the AI assist. The scan was done with more imaging, with more diagnostic information at a substantially shorter 33-minute scan time with substantially better quality. Look at the lead enhancement, completely no. Perfusion is good quality. Image quality of Cine is also excellent and quantifiable. So in summary, Vista.ai is a FDA-approved commercial tool that our program had adopted to automate CMR scanning and post-processing. We perform a 6-month pilot experience. Now, likely we're going to be adopting it into clinical routine care, and then we'll notice that it has shortened the scan time by about 30 to 40% from a 50% scan time previously, and maintain excellent image quality. There's a 3-time improvement in scan time consistency, and it will improve our backlog and wait time and sustain a growth of about 15% per year. And we plan to use this in our neighboring hospital. Thank you very much.